Thank you for joining me this afternoon at the Community Pharmacy More Profit Roundtable. This is the mini roundtable. We do a hour-long version once a month that we bring in products and services that bypass the PBMs to help community pharmacies make and keep more profit. Today, we're just going to focus on some clinical solutions that are available for community pharmacies. So, thank you for joining us. Thanks for taking time out of your busy schedule to be here. My name is Breck Rice. I'm the co founder of ServeRx. I help community pharmacies get the fair reimbursements they deserve on their workers' compensation claims. And I also host the PBM Reform podcast on the Pharmacy Podcast Network. Try to make positive changes any way that I can there. It is a very slow process, and sometimes I feel like I'm hitting a brick wall, but we do bring in lawmakers and other people to keep chipping away at that mountain of the PBM and insurance mafia as much as we possibly can. But we also know the value of bypassing the PBMs, and that's why I launched the other podcast series called the Community Pharmacy More Profit Roundtable. And again, that's every second Wednesday of the month. Because of that roundtable, I was approached and have been approached by many companies offering solutions to help community pharmacies. And I turn away more solutions than ones that I accept. But this is one that I think has some real legs to it and will help community pharmacies help their senior patient population in a way you've never been able to help them before. And it's the remote care today. Their senior management reached out, wanted to be on the podcast, wanted my help to educate community pharmacies. And, when you look at remote care programs, they were usually focused on what physicians could do with their patients. So, like chronic care management, that program launched back in 2015 was really directed at physicians. And then in 2019, remote physiological monitoring or remote patient monitoring came onto the scene. Again, really focused on the the doctors providing solutions to monitor their patients at home. But the new kid on the block, the remote therapeutic monitoring, is an opportunity for community pharmacies to finally get involved and help their senior patient population stay independent, live on their own longer, keep from loss of memory and loss of balance. So there's some amazing benefits for participating and being a part of the remote therapeutic monitoring program. First time that this platform, like I said, has ever been launched to community pharmacies or through community pharmacies. So I'm excited that you're taking the opportunity to learn about it. And it is part of the clinical services that can be offered through community pharmacies. Now, I know community pharmacies are trying to find the right solutions that will bring, more profit to their pharmacies so they can survive. I know that there are more wrong ways to do it than right ways. I've seen a lot of good, well-intended solutions that just really didn't ever get community pharmacy across the finish line. And so we wanted to help navigate those important waters as well. So when we look at, excuse me, when we look at the solutions that are available to community pharmacies, a little frog in my throat today, so sorry about that. I've outlined the 3 steps here. And the first step is the remote therapeutic monitoring program by Remote Care Today. Step 2 is a medical billing solution called IPPN, the Independent Pharmacy Provider Network, fastest growing community health collaboration in the country. I'll touch on that. And then step 3 is a full brick and mortar clinic that is owned by the pharmacy but staffed and managed for them. Now, step 3 may not be a fit for every pharmacy because you got to have the space for it. About a 10 by 12 square foot room that is HIPAA compliant, but it is an opportunity for community pharmacies to expand their scope of services even further. Now, you can do step 1 and step 2 simultaneously. You can do step one without step two. You can do step two without step one. You just can't do step three without step two. So step two, that credentialing with, or getting in a collaborative practice agreement with the provider, getting in network with the payers, that's all a prerequisite to doing the full brick and mortar clinic. But for the next few minutes, I want to really share with you the um, the remote therapeutic monitoring program by Remote Care Today, because this is a zero cost to the community pharmacy to set this program up, and you'll be able to help your senior patient population. And the conditions that are covered here are on the left-hand side, mainly musculoskeletal disorders, but also respiratory and medication management are a part of the RTM program. In the middle column, you see the symptoms that are covered: pain, stiffness, weakness, swelling, limited range of motion, etc. The pretty broad symptoms. It's pretty easy to qualify a patient for the program. On the right hand side are the outcomes. This is addressing the two top concerns that seniors have: loss of memory and loss of balance. So those two things are what seniors are most concerned about, but it's going to help in so many other ways also besides those two areas. Why is Medicare involved in this? Well, because they're spending billions of dollars addressing the concerns of falls and also cognitive plasticity. So, still the leading cause of injury-related death with seniors is falls. Medicare's already spending $50 billion a year. They anticipate that that's going to more than double in the next 5 years. Patients that have cognitive decline are more apt to have a fall. The statistic that's really scary here is dementia patients are 300% more likely to have a fall. Now, a senior is falling just about every second of every day now. So the seniors in their 70s and 80s, 2/3 are experiencing some kind of cognitive decline. And about every minute now, someone is diagnosed with Alzheimer's disease. The program that you'll be able to offer through your community pharmacy for remote therapeutic monitoring has been clinically proven to delay or prevent the dementia. It is clinically proven to reverse a muscle atrophy and help patients have better balance. It is a tremendous opportunity for community pharmacies to offer this solution. So I want to share just a 2-minute explainer video about the program, because this is going to explain it a lot better than I can. The platform is called Brain Health Plus, and it's very comprehensive. So let me show this.
As an independent pharmacist, you already know your patients count on you. And with reimbursement challenges and tight margins, finding new revenue streams that actually help your patients is more important than ever. That's why we're happy to introduce you to Brain Health Plus, a remote therapeutic monitoring program, RTM, covered by Medicare Part B and most Medicare Advantage plans, designed to improve memory, balance, and cognitive function in just 5 to 10 minutes a day. It does this with fun exercises and games that stimulate the brain, increasing neuroplasticity. Your patients can access Brain Health Plus from their smartphone, tablet, or computer. It's a one-of-a-kind RTM platform that offers engaging, fun, and clinically proven activities to improve cognitive health, prevent falls, and helps your senior patients stay independent longer. We're talking about daily brain games, interactive motion sensing exercises, motivational health content, medication management tools like being able to scan your medicines right into the system, reminders of when to take medicines, potential drug to drug interactions, and even geofencing alerts so loved ones are notified if a patient visits the ER or hospital. Every patient also gets a 30-second biometric facial scan they can do at home so they can scan their face and track their health as often as they wish. This amazing technology lets them track important health vitals like blood pressure, heart rate, and oxygen levels with 96% accuracy. Done with a smartphone or even a computer, it keeps patients motivated and engaged without replacing their medical care. And here's the best part: we do it all for you. You get a fully turnkey solution: flyers, posters, bag stuffers, and patient onboarding handled entirely by us. We even do all the Medicare billing. No added staff time, no upfront cost. In fact, no cost to you ever. Just real results for your patients, such as a clinically proven decrease in falls and better memory. And you can earn administrative service fees for simply reviewing monthly patient progress reports for each participating patient, which will significantly add additional profits to your bottom line. Brain Health Plus, easy for you, powerful for your patients, and great for your pharmacy. Click the book of
So as you can see, very comprehensive program. A couple of areas that I like to highlight are the geofencing feature. That's absolutely amazing for, if a senior ends up at the care, emergency room or urgent care, their loved ones will be notified without even a phone call. The bioscanning feature, your pharmacy will have access to that too. It's a great patient engagement tool, and it is very accurate. I've had the opportunity to play around with it, and it is extremely accurate and really kind of a fun tool to have. And so, as the video pointed out, it is covered by Medicare Part B. No stress. Your pharmacy doesn't have to be in network with Part B because Remote Care Today is, and all of their providers are in network with Part B. And most Advantage plans are covering it as well. So, I do want to share one testimonial with you because Paul is 89 years old and he admits that he hates to exercise, but he'll do this program. Now, Ludafit is just one of the tools on the platform. It happens to be the tool with the most clinical studies done on it, and a version of Ludafit is already being used in over 500 rehabilitation centers nationwide. But I love this testimony of Paul because he explains he hates to exercise, but he'll do this program.
My name is Paul Charney. I live in Tucson, Arizona. I just turned 89 years old, and I hate to exercise. When I had the opportunity to try Ludafit, I found it fun. I enjoy it. I enjoy it because it's a game, and psychologically, I know that it's benefiting me. You move, and the avatar, that is a figure that represents you on the screen, it moves along with you. And it's fun. You hear the shushing of the skis through the snow, and you see obstacles in front of you. You try to avoid the obstacles. And my very favorite, even though it's probably the most strenuous, is the Thai rock climb. What you're doing is climbing up a mountain path, and not only are you sidestepping, but along the path, there are rope ladders. And in order to climb a ladder, you reach your arms up and you just keep moving. My kids saw me exercising and they wanted to try it. And they were laughing, and it comes with a lot of giggles anyway. Initially, when I first started it, I had to hold on to a chair. But I found that repeatedly doing the exercise, I got confidence in letting go of the chair. So right now I do it freestanding. Bottom line, I'm sold on it.
So I love Paul's testimonial for a couple of reasons. He talks about avoiding the obstacles as he skis right through a boulder. But I love the fact that this is proving to reverse his muscle atrophy. He had to hold on to a chair, have something to stabilize himself when he first started the program, and now he's completely doing it freestanding. Now, Remote Care Today is going to provide all of the patient education tools that are needed for your patient encounters. And there's never going to be a cost to your community pharmacies. So they'll provide all those materials for you at no cost. Posters if you want them, flyers, bag stuffers. They're actually working with a company that does the printing right on the bag itself, and they'll set up a landing page for specific to your pharmacy so that it's kind of like your own website that you just direct patients to that landing page. On that landing page, they're going to have all kinds of information. They're going to have testimonials like Paul's and other testimonials that are on there. They're going to have all the benefits that they're going to get from the program, and then they can enroll from there. One of the things that remote care today likes to have is whoever the face of the pharmacy to do a little welcome. So if that's you, or if that's a bubbly tech that all your patients know and love, have them do the little welcome. They'll script it for you and everything. You just want to have a familiar face on that landing page for when patients go there. They'll see, oh, that's my pharmacist or that's my technician. Also, let remote care today do as much of the heavy lifting as possible. They can actually set up the communications that go out to your patients to invite them to that landing page. Never a third party contacting your patients. So it's always through your own pharmacy's system. So if you're doing SMS texting for refill reminders or that it's time for your flu shot, they will use those same communication outreach. They'll even do postcards and other things like that, but it'll be coming from your pharmacy always. So, want to show you what your responsibility is, other than just helping to educate the patients and send them to the landing page. Remote care today needs your assistance to do an administrative service for them. It's kind of a checks and balances. So care coaches will be assigned to the patients, helping them progress through the program. The pharmacy is going through and double checking, making sure that the patient is showing progress, notating it if they're not. That way, it helps the care coaches adjust the program. This 30-second video here shows you what the pharmacy's responsibility is.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
So it really is that easy. It shouldn't take you more than a minute per review. So in this example here on the screen on the right-hand side, if 100 patients were on the program, should take you less than 2 hours to do those reviews. So, $1,250 an hour is not a bad return on your time investment. Some of you have multiple locations. You can centralize this administrative review. We're in the process of helping a grocery store chain up in New York that has over 100 locations set up the program, and they'll actually have one clinical pharmacist that will be doing the review for all 100 plus locations. So you can also do the same if you have multiple stores. So the next steps on how to get started are covered in this little video right here.
To get started, your next steps are easy. First, complete our agreement and sign the BAA, which ensures HIPAA compliance, and then we'll schedule your onboarding meeting. During this meeting, we'll show you what we mean by a turnkey solution. We'll discuss how we engage patients and the materials we can print and provide you that help patients engage with us. We will then educate and onboard your patients using approved text messages, emails, and friendly phone calls, providing the patient the appropriate programs and coaching, all without any cost to you. And don't forget, you can earn monthly administrative service fees by reviewing your patient's progress. It's about better care for your patients, more profit for your pharmacy, all with a zero out-of-pocket investment. Let's get started.
So I invite any of our community pharmacies that are here today to get with the care consultant that invited you to this more profit roundtable and get set up with the BAA and agreement to be sent out to you for you to review. The two main takeaways are, for me today are, let's start with the free services that can move the needle for your pharmacy and bring pure profit in. Utilize the ServRx bin and PCN to get more fair reimbursements on your workers' comp claims. And if you need a refresher on that program, we're happy to help. If your pharmacy needs an updated, a mouse pad sent out, which has all of the, bin, PCN, group number, the steps and how to process, we can provide those for you. The other no-brainer here is to get set up with Remote Care Today and provide the remote therapeutic monitoring program. Again, no cost to you to do those two programs. Now, if you do want to really expand your scope of services into more clinical solutions, that would be the Independent Pharmacy Provider Network, IPPN, is the fastest growing community health collaboration in the country. There is a startup cost to this. It's not as much as it used to be. There are services out there that were offering a lot less and charging a lot more. And that's why we're happy to partner with IPPN. It's really a win win win. The patients win because they have easier, more, it's just more accessible to go to a community pharmacy than waiting around for a week or month to get in to see your primary care provider. The primary care providers still win because they're still managing the care plan for those patients and they're getting paid for that. They're getting compensated. These care solutions also improve their quality measurement scores because they're missing their care gaps that they're missing in that patient's services, and the pharmacy can provide and fill those care gaps, which then improves the quality measurement score for the doctor. But the pharmacy wins the most in this scenario because approximately 67% of all the bill charges stay with the community pharmacy. So it's a tremendous program. One of the lowest hanging fruits that community pharmacies are using this program for is the continuous glucose monitoring. So at the top there, you see the CPT codes for CGM. Community pharmacies today are out of the kindness of their heart are helping patients set up their glucose monitors and showing them how to get their data, but there's no way of billing for that consultation. In IPPN, you can bill for that. In fact, it works out to be about $150 per patient per month on that program. It also turns a flu shot that you're only getting reimbursed $17, $18 for from your PBM into a preventative health visit. So all the 99391 through 99397 codes are the preventative health codes. So instead of getting just $17, you're getting $85 on average for a preventative health visit. And then the step 3 was the BRIM Wellness Program. You name the clinic, it's your clinic, you own it, you name it whatever you want. BRIM is like the Intel inside, so they're the managed services. So this 3-legged stool is pretty simple. The first leg of the stool is all of the setup of your clinic and the management of your clinic. The second leg of the stool is really cool. It's like Uber for medical staff. You may have services you want to perform that require a nurse practitioner, but it's expensive to have a nurse practitioner on staff. So just post the clinical day that you need a nurse practitioner, and the nurse practitioner fills that slot. So like I said, it's kind of like Uber for medical staff. And then the third leg of the stool is what I'm actually the most excited about because that's the financial vehicle. A community pharmacy can borrow from the pharmacy fund to set up their clinic. And when you pay back the fund, you become a cooperative member of the fund. So not only are you helping the next community pharmacy get their clinic set up, you're earning interest on that fund. And someday, you want to hand your pharmacy down to the next generation of community pharmacies and retire. This could be part of your retirement. So thank you so much for participating with the Community Pharmacy More Profit Roundtable. This is the mini version. I've been your host, Breck Rice, one of the co-founders of ServRx. If there's anything I can do to help you, I'm here to help community pharmacies not just survive, but thrive. I've outlined the 3 steps here for clinical services and would be happy to help you, further your investigation into any one of these 3 steps. Again, appreciate your time this afternoon.